Matt is a business owner from Las Vegas that enjoys outdoor activities and spending time with his family.
Well, I got a physical job. I'm an air conditioning mechanic. I own an air conditioning company. I'd be climbing ladders, crawling in attics, carrying tools. I got 6 kids. My hobby, so to say, is riding long distances on a bike. Love to water ski. Slowed down on the snow skiing. I was a snowboarder.
Matt's initial injury happened on the job in the 1990s. Over the years, however, the pain ultimately progressed to other areas of his lower back.
I remember when I first did it, it was at work moving a large object, and then later like remodeling the house and doing some baseboard work. And then it just seemed like to reoccur maybe quarterly. And then I developed a constant lower back pain, maybe around 2000. And I'd always have to push on my lower back to relieve that area. Seems like I was always walking around pushing down on my lower back. So it seems like I had two conditions.
Eventually, the pain began making it hard to work or spend time with his family.
It started with a pinching of a nerve, and each time a nerve would get pinched, it's always the same area. Take about 3 to 4 days, maybe a full week to recover. Slow recovery to get back on my feet and get going again. It wasn't good, especially if you had to be in tight spots, taking the ladders off the top of your truck. So I have employees, but still I get there and do work with them. So it slowed me down, and I was concerned of being able to provide for my family. What was I going to get to the point where I couldn't work anymore? A little embarrassing as a father and a provider for them to have to see me lay on the bed for 2 and 3 days at a time before I could even get up and move around after I'd have that reoccurring of pinching in the nerve. Yeah, I had to get the inflammation down and get to where I could walk again and move, and then it was normal until I'd pinch that nerve again. So, and then just reoccurring, a quarterly thing, I could almost depend on it. And it's just taken me out of work for 3, 4, sometimes 5 days is pretty annoying.
Matt used medications and other conservative treatments to get back on his feet.
I would take muscle relaxers and naproxens to relieve inflammation, ice on my back, and it was like a routine for many years. Well, I started going to a chiropractor and would visit him each time I pinched the nerve in my back, and he would adjust me, and I eventually got some injections. The injection worked for a while, but I don't think I was going to keep going for injections. And the chiropractor just got me back to the point where I could start walking a little bit. So, but it wasn't taking care of the problem. It was just relieving me for a period of time.
Realizing these therapies were only treating his symptoms and not the source of his low back pain, Matt went to see a surgeon for help.
I had been to some orthopedic surgeons, and I wasn't comfortable after visiting with him, so I delayed that, and I'm glad I did because later I found the Bonati Institute.
Not wanting to undergo traditional open back surgery, Matt started searching for alternatives to eliminate his low back pain.
That was like around 2011. I just couldn't. I had been asking questions to people about the back surgeries. What was the best procedure? What my chances of recovery might be. So for years I was preparing and asking questions to people, but like I say, in December or late November 2011, I pinched the nerve in my back again. I went to the computer and I just started doing internet searching, and I found the Bonati Institute. Watching the testimonials, I felt most comfortable. I had a good feeling. So I just used my gut instinct of this was the place and the procedures that I was looking for. Made a call that day. They requested my MRIs, and I sent those to them. They felt that what I described to them, that they could help me. It was very quick. It was from the first initial contact, and I think it was within 2 weeks. I was on a plane and I was there.
Upon arriving at the Bonati Spine Institute, Matt was provided updated MRIs at the on-campus imaging center and a short time later met with the surgeon to discuss his customized surgical plan.
Everybody's very helpful, made me feel comfortable, take you through testing the nerves to the MRI room to your diagnosis and best procedures. So I felt very comfortable during the visiting with the many doctors and assistants. So he did look at the MRIs. It was clear in showing the MRIs that I had more bone growth in one side of my spine than the other. It was very clear to see that. And so that made me feel comfortable there. And then as he described the procedure of opening up that canal to give that nerve more room to pass through. Yeah, you're looking for some confirmation. So you don't want them, you want them to tell you what's wrong, so you feel more confidence. And after consultation, they set up the surgery times.
The exclusive Bonati Spine procedures are performed on an outpatient basis using conscious IV sedation, where the patient remains awake and communicating with their surgeon to ensure their source of pain is eliminated before they leave the operating table.
I saw that on the testimonials and in the videos before I ever went there, and I thought that was interesting, and where you can comment on how you feel and while they're doing the procedures. I thought that was interesting. I had 2 procedures. I remember the first one and them asking me questions while I was during the procedure. The second one, I don't remember them doing that, but that was part of my decision of going down there, of being more comfortable with the procedures they do and how they do their operation. It was the decisive point of me going there. Having an opening the size of a dime in your back that can be stitched up versus cutting you wide open, maybe in the front or or your back, and so that minimally invasive surgery is what prompted me to go to the Bonati Institute, and I'm glad I did.
After the targeted Bonati Spine procedure, patients are free to begin the recovery at home or a nearby hotel.
The procedure was quick and non-invasive, and you're in the recovery room and you're up and walking within an hour or so after the procedure. So part of the recovery, I was walking around the hotel, taking laps around the hotel parking lot the same days of the surgery. So that was quite encouraging. I've assumed my regular routines, climbing ladders, carrying things up on the roof, assisting my guys. So I feel that both procedures were a success, and I'd do it again. I had 2 procedures in 3 weeks from the time I first contacted him till the time I was home.
Matt highly recommends the Bonati Spine Institute to anyone suffering with neck or back pain.
I have nothing to gain from this testimony. I'm grateful to give this testimonial because of them restoring quality of life and activity for me, and more especially to be able to work. I go through exactly what I went through. I've talked to many people since then, friends and acquaintances, and encourage them to look up the Bonati Institute on the internet and to view the testimonials, to contact them and see if there's something the Bonati Institute can do for them.
Now pain-free, Matt is able to return to the activities he loves.
I still ride a bike today and feel comfortable going long distances, don't have any problems, the back doesn't tighten up.